Good afternoon, everybody. This is Dr. Knight with the Paragon Counselor, and today I wanted to make a video, a shorter one, about how to understand briefly and apply tactics to overcome immediate short-term feelings of depression. Okay. I did put out a much longer video that went deeper into the mechanisms of that, so just feel free to look at that if you want to go deep and understand the intellectual portions. Right now, I'm just going to briefly glaze over those, and we're going to sort of get to the bare minimum information required to understand what to do and why. Okay. But there is a deeper dive elsewhere on the channel. So if I run through this quickly, that's what we're doing. All right. So, real quick, depression is a biopsychosocial condition. That means it can affect the body, the state of thinking, or lifestyle and social and cultural factors. Okay. Sometimes depression is an organic condition due to a medical or genetic issue, or maybe a deficit of basic needs. But for the majority of cases, it's probably safe to say that depression is a lifestyle response or a habit response or a response to a lack of adaptive conditioning. Okay? And, the only way to really know if, let's say you are depressed, if you are experiencing depression, the only way to know for sure if your depression is because of a incurable mechanical organic issue or if it's because of how you're living, thinking, conditioning yourself, you must try your best over time to realistically apply adaptive conditioning capabilities and tactics and techniques. And if you do them in the conditions that are purported to give success and you see no changes, then it's probably safe to assume that if you followed the techniques with fidelity over time and you got nowhere, very high likelihood that you have an organic depression issue. And that's when I would certainly start to look at your pharmacology options. Another thing I would get across is that if you're in an emergency state and you're thinking about permanent solutions to temporary problems such as suicide or destructive behavior, then, whether or not the problem is organic or lifestyle, you don't have the time to figure that out. You need to go get pharmacological help, okay, and maybe even supervision. So, that all being said, depression is biological, psychological, societal. It is sometimes organic, usually in response to lifestyle and conditioning. You only know by trying to improve your lifestyle, mindset, and conditioning and checking for results. Okay, so that's what we're going to give you the beginnings of. How do you do your best to quickly reverse that crushing depressive mood? Okay, so with that, on the biopsychosocial, we're going to stick primarily to the biological today, because if you don't get that in order, it becomes very hard to do the longer term work. All right. So if we look at what depression is biologically, it is a deficit of chemicals that provoke feelings of energy and well-being. All right. I can list off a bunch of these. We've got dopamine, anandamide, norepinephrine, but it's also stress chemical, serotonin, endorphin, vasopressin. Any set of chemicals designed to motivate you to take action or to feel a reward for past actions or anticipation of reward for future actions. These tend to pull one out of depression. Okay. So if you feel a sense of fatigue, disinterest, apathy, or sadness, that's probably an indicator that your reward chemicals are too low to do the job of giving you the desire to happily take action. Okay. So, and then, of course, we went into this in more detail, but the modern lifestyle for most people is extremely conducive to anxiety and depression. Okay. High work hours, resource fears, constant iteration of negative tribalism, of pressure, of competition, of difficulty. We are in an extremely difficult environment with which to innately be happy or to counter depressive states or anxious states just by unconditioned autonomic following of the program. If you do what most do, you will be depressed and anxious intermittently with a high likelihood for much of your life. Okay. Another thing to understand about depression is that often It comes after a period of stress, anxiety, and pressure that goes untreated. And to get through that period as long as possible, you burn up your reward chemicals, you push yourself, you try to make it happen. But of course, results are slow, and pain is right now. Okay, so if you're in a lot of stress and you really, really tried to work hard, but conditions weren't in your favor, then you're going to eventually deplete if you're not doing that wisely. And then you will slip from that anxious, agitated, tense, stressed out state into lethargic, apathetic sadness. Okay, though, I would personally rate depression to be worse than anxiety just because it feels, in my view, significantly more miserable, and it's also harder to get out of. Okay, so that being said, if you are experiencing sadness, depression, there's a high likelihood that your world just kind of made it likely that you were going to land there. Okay, so once you're there, whether you got there through being overworked, whether you just didn't have rewarding experiences or lifestyle situations, or you don't have much liberty over your time, or you don't feel happy about your future, and you're ruminating and exhausting yourself, this is where it ends up: exhaustion, apathy, sadness. Okay, so the reason why we're going to go after the biology, the lifestyle conditions that need to change to not gear you back towards apathetic exhaustion and misery, that takes a long time because it's a matter of competition and scarcity. Okay, physical fitness, economic fitness, lifestyle, geographic preferences, all of these sort of beneficial lifestyles, careers, outcomes, social experiences, proximity to opportunities. These are things that the vast majority of humans are competing for. So unfortunately, in most cases, achieving those external conditions are longer and harder than changing the internal conditions. Now, if you change the internal conditions defensively, you will want to move towards changing those external conditions with your increased mental capabilities. Okay. What we're going to talk about today is purely defense. All right. It's going to be getting your emotional state out of sadness, apathy, exhaustion, which allows you to start the real work. Okay. I know I'm being a little repetitive here, but once you get your mood stabilized, that is the beginning of the job. After that, you need to work on lifestyle changes, and you need to cultivate thinking and reflection patterns that don't lean towards reactive stress responses, that don't lead towards negativity, self-defeating attitudes, limiting beliefs. Okay. But whether it's your thinking patterns that require 50,000 repetitions, myelination, all that good habit stuff we talked about in other videos, or whether it is trying to make your lifestyle less oppressive, crushing, and miserable, those both take a long time, a lot of effort, a lot of competitive grind. So the only thing available for you to change right away is the biology. And this makes sense because if you look at what psychiatric medications do, if they work the way they're intended, they don't make you wealthy and they don't give you a difference in mindset. They just crush that unpleasant mood and hopefully allow you to function. Okay. So, with all that out of the way, what can you do innately to improve your mood so that you can do the lifestyle and the cognitive work to improve your future and hopefully prevent this mood from happening again? Okay. The first thing you can do is exercise, but specifically, and with all these techniques, check with your physician. This is not medical advice. Common sense disclosures, learn your own health, take responsibility for that, and engage with healthcare providers as appropriate. Strength training, high weight, low repetition, testosterone and other androgen boosting exercise will do more for buffering depression because androgens give you energy to begin with. And also, the higher your free testosterone, the lower the activation of your amygdala, which is your trauma center. If you push heavy weights relative to your own strength and medical capability, you will probably find yourself slipping out of the prey, defensive, victim mindset, and you will start to see stressors as just stimulating challenges rather than crushing events. Okay, so heavy weight low rep within medical limits, do that over time, and you will start to change your physiology to where you take a more engaged and aggressive outlook towards your problems rather than wanting to run away from them. Okay. The next thing you can do is breath work of some kind. Now, in the other video, we talked about the difference between parasympathetic and sympathetic nervous systems, rest, digest, fight, flight. You want to get out of sluggishness when you are depressed, okay? And to do that using your breath, it's more about pulling in O2 than releasing CO2. So to get more of a sympathetic nervous system activation, you want to breathe in twice as long as you breathe out, because you want the perception that you are rapidly pulling in large volumes of oxygen, which stimulates, high intensity movement, which makes the body gear up to take action. Okay, so if you breathe out 6 seconds, you want to try and stretch your lungs to breathe in for, say, 12. Okay, that may not always perfectly happen, but you'll know you're doing this correctly if you start to get a little lightheaded, a little euphoric. And again, this is a weaker technique, so you're probably going to need about 5 to 10 minutes on the clock of just constantly pulling in deep air. Okay. A way you could take this to the next level, and I'll make a separate video on this later, but you do something called Tomo meditation or Wim Hof breathing, and this one you should especially check with a physician before you engage. But you perform that all in, half out, hyperoxygenating breath work. And then when you've done about 30, 40 repetitions, you stop, you lean back, and you hold your breath for as long as you can. Make sure you're in a seated, supported place. You're not operating machinery or a vehicle, some common sense stuff. But what will happen is the act of forcing yourself to hold your breath beyond that 2.5 minute mark is going to cause a norepinephrine spike to flood your body. This doesn't work very well if you can't make yourself endure the struggle past that 2 to 3 minute mark. Between 2 minutes and 3 minutes is when you're going to get that heavy activation of norepinephrine. If you can't do it, then you'll kind of stress yourself out and you won't really get the punch, so you won't really get the payoff. But if you can make yourself endure over 2 minutes through practice, so all in, half out, all in, half out, all in, half out, 30 to 40 reps, hold, lean back, and make yourself endure beyond 2 minutes. And you will push yourself right out of a depressive state into an anxiety agitation state, but that is better because you could take easier actions from there, okay? Another thing you can do, using the same mechanism of trying to provoke a norepinephrine rush, is you can engage yourself with cold water. Now, how cold depends on your tolerance level, your climate, these sort of things. But if you're in a depressive state, I wouldn't play games. If you're medically safe to do so, I would grab ice, half water, 1/3 ice, 2/3 water. Take some deep breaths, do the sympathetic breath work, maybe the Tomo if you have that technique down. And I would get in the water right away. You don't need to be in for more than a minute. The shock of doing that will cause you enough agitation and tension where the norepinephrine overrides your lack of reward chemicals and you're ready to get up and move, okay? And another thing too is when you're in a depressive state, your cognition, your active thinking, this is not your friend. Most of your active thoughts are going to be pessimistic, they're going to be destructive, and they're going to talk you out of taking effective action by highlighting all the potential problems with said effective actions. It is better to act first and think later with regards to countering depressive mood through your techniques, okay? Once you have some immediate stabilization of your depressive mood, that is when I would look around my immediate world and start attacking my to-do list while I have the burst. Laundry, cleaning, cooking, call people, set up schedules, homework, whatever that has been piling up because you've been too depressed or too exhausted to care. I would go after that with that window of power that you've cultivated through your techniques. And hopefully that will provoke a sort of, positive feedback loop where now you are recharged and energized and ready to start the cognitive practices and the lifestyle work. And we're going to go into deeper details on the longer term stuff in future videos. So just to recap, guys, focus on the body because the mind and society is too far off to change when you are currently depressed. Heavy weight training, breath work, sympathetic breath work or Tomo/Wim Hof breathing, ice water. If you do these things, You may not be in a happy mood when you are done, but you will be in a more energized, active mood. You do this, then you execute small tasks, you start to think about the bigger picture and what you're going to do next from there. Remember that these techniques alone are playing defense. If you only do these, you will constantly be intermittently be chasing your tail. Okay? So I hope you got some value out of this. If you have any questions about particulars, drop them in the comments or reach out to me through email. But thank you for your time. So.